Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Patrick Dotz. He's a healthcare executive. Today's Kevin MD article is Efficient Staffing Partners for Health Systems. Patrick, welcome to the show.
Thanks, Kevin. Happy to be here. Excited to talk to you today.
So let's start by briefly sharing your story and journey.
Yeah, so I've been with the company Streamlining Health for a little over 12 years now. We're based out of Atlanta, Georgia. I'm originally from Ohio, and I met my wife in Ohio, but she's originally from Georgia, and so we moved down here. And a little over 12 years ago, I stumbled upon a friend of hers who referred me to the company. And to be quite honest with you, didn't know a whole lot about healthcare staffing when I started. You know, when I went to school, I was a sport management major with a minor in entrepreneurship. And so really when I arrived at Soliant and I learned a little bit more about what we did here, you know, we were really a relatively small company. And so over that time as I started off in a recruiter role and also working as a sales executive with our hospital clients, I started to learn a little bit more about the business side of staffing. And over that time, I moved from a sales role into a leadership role. And as of today, I help lead an organization of over 150 colleagues who help staff and partner with clinicians and hospital providers all over the country.
All right. So in your Kevin MD article, Efficient Staffing Partners for Health Systems, we're going to talk about that in a little bit. But we always hear about healthcare staffing challenges. It's always in the news. And as a physician myself, I see it every day. Just from your perspective, just give us the context of some of the staffing challenges that we're facing in the healthcare system today.
Yeah, and I think obviously COVID has created a much larger spotlight on the staffing challenges. But really, this is an age-old problem, as you know, even going back to, you think about when the ACA was implemented in the back in around 2012, you really saw this demand start to explode in terms of you had more people coming online in terms of insurance, but yet our supply has never been able to keep up with that growing demand. We've got an aging population, a population that isn't getting any healthier. So you've got just, again, this is all pre-COVID, you've got this demand that continues to outpace the number of people we can put into schools. Affordability of schools is an issue. The number of people able to teach in the schools is an issue, to get more allied professionals, nursing professionals, doctors. And so you've had these systemic supply side and demand side issues even pre-COVID. And then COVID just exacerbated those issues. And we see it all over the country, whether it's a hospital provider, a local clinic, a cancer center, an imaging center. You know, there's not a single business that's tied to healthcare that doesn't run into these issues. And although the COVID pandemic sort of demand has contracted and we're in a little bit more of an equilibrium, it's worse than it ever was. And I even read an article this morning that nearly half of all healthcare workers plan on leaving their career field in the next year. I think the number was at about 46%. That was an SIA cited number, and that's a little scary. Scary as somebody who's the father of two children, and the idea of going to a hospital and being short-staffed. And so that's the systemic problem we have on our hands.
Now we hear a lot about the numbers in terms of how stark the shortages are. But for those people who are listening to you here, tell us the impact that has on patients. Are there any anecdotes or stories about how some of these staffing challenges can directly impact patients?
If you've ever had to visit an emergency room, everybody probably has their own story. You know, recently my son broke his arm, and thankfully it was a situation where he was, wasn't life-threatening by any means, and it was painful, but it was a Sunday afternoon in the fall here in Atlanta. And we went to one of the children's hospital ERs, and there's 110 patients in the waiting room. And they only have one orthopedic team able to perform any sort of procedures. And, we were in that hospital for a broken arm to get reset and casted for 8 hours. And, that's for And that's a 5-year-old kid who you're looking at and wondering when is he going to get the healthy needs. And I think, luckily in our scenario, it's not life threatening, but we hear stories from our nurses on assignment or our allied professionals on assignment of just the sheer volume of patients that they have to see. And we know when we have more patients, when that patient ratio gets too high, it can put lives at risk, and it can cause burnout with our clinicians, and at the very best, it creates a scenario where patients are just unsatisfied with the care they get.
Mm.
But the worst is obviously a patient's life, depending on the severity of the issue. And we hear that time and time again from our consultants out in the field.
And the problem isn't just the fact that there's a supply side issue. There's also a turnover issue as well. Is that correct?
Yeah, that's right. If you really look at workforce participation over the years, especially over COVID, we saw a lot of female-based employees, not just in healthcare, across the industry, leave the workforce. And in healthcare, where it's disproportionately more female, we saw that as well. And we're also talking about working conditions and work environments where they're short-staffed on leadership as well. And if you don't have great leaders, you don't have great programs in place, it creates dissatisfaction with employees when they're overworked and having to work mandatory overtime. You're going to burn your staff out, and it creates a lot of and then on top of that, you're dealing with stressed out patients, depending on where you're working. Quite frankly, you got to think about turnover in a couple different buckets. One is internal turnover, which one of our large hospital providers that we partner with was talking about this, where they have a lot of internal turnover where somebody may be working in ER, med surg, or ICU, and then move to a different role that's maybe non-patient facing within the organization, maybe whether that's leadership or management, but that leaves a gap back at the bedside. And then there's external turnover where they either leave and go to another hospital system, but what you're seeing more is they're leaving the hospitals and going to more non-hospital based positions, whether I got a neighbor who works across the street who used to be a NICU nurse who now works for a company that specializes in doing blood draws and doing IVs for people who are dehydrated, or also what they call personalized medicine for athletes. And so you have that turnover, but then there's the turnover of people just leaving the industry altogether.
Mm.
And that's our biggest issue, because those folks are just completely vacating the workforce in healthcare, and that's probably the largest issue that we have in play here. And turnover just creates instability with our clients and with our patients.
And for these staffing challenges, are you seeing that across the healthcare spectrum, whether it's a small community hospital or a large academic medical center?
Yeah, there's not a single hospital that isn't dealing with this issue in some manner. And to the large hospitals have more resources they've got more efficiencies that allow them to put more programs into place, whether it's their own internal contracting or working with multiple providers or running an MSP through there or having a design flow pool. Where these more rural hospitals really struggle is, although the volume of needs are lower, filling in those gaps is much more difficult. We help those hard to fill openings for more of the rural hospitals, because although they only may need a handful of travelers at a time, or contractors, or or even perm staff, they do not have the resources, the knowledge, the bandwidth to be able to fill those openings.
All right. So in your Kevin MD article, you talk about some of the approaches to solve some of these issues. So talk more about that.
Yeah, I think a lot of our hospital clients, especially if they're new to into the administration role that they're in, or maybe they're a manager over a department that's never used travelers before, they don't understand how staffing companies are designed and work. And there's no staffing company that's exactly the same. And I think traditional staffing models, I think of these brick and mortar local, I'm going to find you somebody down the road to come walk in the door. And the reality is there's companies that specialize in more of that local per diem fashion. There's companies that specialize in the travel nursing world, and there's companies that specialize in the travel allied world. And then there's some companies that are just focused on specific areas within the hospital. For example, there are some companies that all they do is surgical services or imaging. And what you want to do is understand what are your needs? How many vendors can you really work with to fulfill all those needs? Because if you work with somebody who's sort of a catch-all and doesn't really specialize, you may not get the unique skill set in the timely manner that you need. If you run a unique cancer center program where you need somebody with specific equipment experience, certain background, whether it's in proton therapy or any sort of a specialized approach, sometimes it's better to partner with somebody who's got a lot of depth in that arena. And finding that right partner takes time, and you kind of have to do your research. But typically, what you'll find is when you work with companies that are more specialized, you'll get a quicker turnaround, but also candidates that fit exactly what you're looking for, not just from an experience standpoint, but culturally as well. Staffing companies like to build a depth to their staffing in terms of experience, because they know that a first-time traveler, while they have the skill set, maybe they don't know the ins and outs of walking into a new hospital for the first time, and it's only for 13 weeks. And so finding people who are specialized and have that depth is really important. And then there will be companies where you need to work with them to maybe find somebody that help you build a per diem pool. You really have to look at it as, what are my needs, and then what are the vendors that could help me fulfill those needs the best. And so I think that really will help you build an expansive network, but also help you build one that's specialized for you.
So tell us a success story where you partner with a specific medical institution and really move the needle and help some of their staffing challenges.
Yeah, so there's and I'll try to keep the hospital anonymous here, but there's a large level one teaching facility in the Southeast that we work with closely over the years. And one of the things that they really struggle to do is bring on new heart programs. And so when they bring in us, when they want to build up their ability to do cath lab procedures, that's an area where we really specialize. We understand that a non-invasive procedure like cath and IR is preferred, not just for the patient but for the hospital as well. And but the idea of going out and finding not just the surgeon who can do that, you've got to get the techs, you've got to get the nurses, you've got to get everybody to help support that. And when you're launching a new program, you know that takes a staffing partner really to help you. You got to get somebody behind that. And so that's a hospital where we've consistently supplemented and helped them create stability within their heart program there.
Now, in terms of other options, if a institution chose not to partner with a staffing company, what other options do they have to fill some of these shortages?
Yeah, I think if you're going to go the route of not using an expert outside your facility, you've got to take a long, hard look at what are the true costs if we try to do this internally. And I think money is obviously a big driver for a lot of professionals, but money only goes so far in terms of attracting talent. You got to have an internal staff. If you really want to build out a robust program internally, you've got to build out a staff that knows how to go out, find candidates, attract talent, and then keep them in your workforce. And the reality is when you look at the cost of doing programs like that, sometimes it makes sense to have that and still have a staffing partner, because the staffing partner is going to cover a lot of the costs that you're really not thinking about it as administration. Whether it comes from recruitment to contracts to legal liability to medical benefits and payroll. All of those things are something that we provide, and credentialing. The cost of getting somebody to an assignment keeps going up and up and up, because whether it's because they have to keep up with their certifications or their medical records. These are all things that you have to consider when you're trying to beef up your own internal program. It is an option, but I would think of it as a multi-pronged approach of, I've got my own internal staff. That's the first approach. I want to build out an extensive float pool network that we control. We'll try to do some contracting labor ourselves, but even through all that, even our largest clients with the most resources still have to use partners like us. It is just the reality of doing business right now. And so we really encourage people do encourage our clients to do all four of those things.
Now, as a physician, I certainly have had some experience dealing with a variety of support staff and nurses, and especially during the pandemic, they would come from all parts of the country and come to our institution. Tell us the process of sourcing your traveler per diem staff, and how do you
Yeah.
maintain a network of people ready to go?
Yeah, the number one thing that our company has on our side is we've got 32 years of experience, a robust database, and extremely good SEO. And so we really try to have a strong web presence on social media, on job boards, all those things to get people attracted to us. And I think that's another thing when you think about a hospital and their capabilities in terms of being able to spend those marketing dollars to attract talent in the door. That's just not something that they're able to budget in or really have experts in. And we've got 32 years of expertise in that arena. And so we get a lot of candidates that seek that through us. But our number one way of getting candidates is referrals. And simply meaning when we get a candidate who goes on assignment with us and we want to treat them, the way they should be treated, which is they're out there patient facing, they're the ones making life better for the patients and the families out there. We want to treat them in a way that makes them say, when somebody wants to travel or be a contractor, I'm going to refer them. And that's still our best quality, and our number one source is our referral network. But when somebody really approaches us for the first time, we do our own internal interview. We want to make sure, one, that their needs are something that we're going to be able to help them with. Two, that their skill set is going to be able to be transferable into a travel contract, something that where they can get into a hospital and hit the ground running. So we want to see what type of experience they have. And then we got to qualify the person. Anybody can get on the phone and say they do something, but we make them go through, we do reference checks. We have them complete a skills checklist. We obviously collect a lot of their education and certifications, and make sure that they're qualified to go on assignment. And then after that, we really go to work on tailoring the job market to their needs. And so I think one of the biggest complaints we hear from travelers about other companies is they just shove them into roles they're not qualified for, just to get them on assignment somewhere. And the reality is that just creates dissatisfaction with the hospital, creates dissatisfaction with the candidate. And so we've got a robust database, and we spend a lot of money on artificial intelligence and automation to ensure that we're getting a complete picture of what the jobs are across the country as much as possible. But we'll also make calls on behalf of that candidate. We've got an extensive client network in our database as well, to where, if I'm working with somebody who is a CVR nurse, for example, I may have an extensive list of contacts that I work with in New York if they want to go to New York, and I'll give them a call and we'll see what their needs are at that time. And so I think we're not interested in just shoving people into jobs. We're really interested in making sure they're going and meeting their needs.
We're talking to Patrick Dotz. He's a healthcare executive. Today's Kevin MD article is Efficient Staffing Partners for Health Systems. Patrick, will end with some of your take-home messages to the Kevin MD audience.
Yeah, I think the biggest thing to remember is our healthcare professionals make the difference. Our role as our role at Soliant is to really provide you guys an opportunity to explore not just the country, but explore new opportunities, new skill sets, whether it's your future employer. We've got a lot of great stories around candidates who are on their second, third, fourth travel assignment, and they fall in love with the hospital and they end up staying there perm. And those are great stories. Even though we love to have people in the door, our job is to make life better for those that make lives better. I want to encourage anybody who's a healthcare professional to really view their staffing partner as a partner and a colleague, and just know that you guys are making the difference, and that there's a lot of opportunities out there for you guys to help in not just the community you're in right now, but other communities around the country. You all are the difference makers, and we're just here to help support that.
Patrick, thank you so much for sharing your time and perspective, and thanks again for coming on the show.
Thanks, Kevin.